The Longevity Lounge is proudly brought to you by AIA Australia, dedicated to helping Australians live healthier, longer, better lives. Welcome to the Longevity Lounge. Today we're exploring the groundbreaking world of regenerative medicine and the pursuit of optimal health with Brendan Murphy, the visionary founder of Innovita Life. Innovita Life is revolutionizing the way we approach longevity and wellness, offering personalized regenerative therapies that blend cutting-edge science with a deep understanding of individual health. Brendan's mission is all about empowering you to extend not just your lifespan, but your health span. Those vibrant, active years where you're living life to the fullest. Tune in as we uncover how Innovita Life is helping people unlock their biological potential and redefine what it truly means to live a long, healthy, and fulfilling life.
So, Brendan, welcome to the Longevity Lounge.
Pleasure to be here.
And Brendan, we're in Australia. We know you're overseas. You've been over there for a long time now, over in Madrid. We'll go into that. In Australia, where do you reside when you're normally here?
So postcode is Palm Beach, but Well Beach is the closest.
Not far from Carl and I, Coleroy Beach.
It's an important fact to start the podcast with. So, Brendan, on to things that are actually more meaningful and useful to our listeners. You are in our podcast list right at the very bleeding edge of science in what you do and what you've dedicated your life to. Can you talk to us a little bit about that and its implications on general health?
Absolutely. So, look, I've been very lucky to work with probably the leading immunologists in the world, where our specialty is looking at cancer and autoimmune, so chronic diseases. As an extension of that, it goes to our cell health. And cell health is the key to both fighting disease and also longevity. Not being a doctor, but with a science background, I have the ability to cut through a lot of the detail and look at these from a very practical perspective.
I think that's incredibly important because we, particularly in your field, it can become so detailed that it's difficult for people to, one, understand exactly what it is that we're talking about before we even get to the regulatory considerations of can they get access to it. I know immunotherapy is certainly very popular, and it's always, I imagine it's first line therapy now for many cancers worldwide. Can you talk to us a little bit about where your work fits into that?
So, systemic treatments in most medical systems are, the usual, the chemotherapy, radiotherapy, surgery, and of late, drug immunotherapy. We don't get involved with any of those, although we fit in with them. So we merge our programs, which are based on cell immunotherapy. So let me explain very quickly. For example, cancer is a disease of the immune system. So ignoring the immune system is not going to give you the best result for any cancer events. Cell immunotherapy is not in the Australian system. It's not in the UK system. It's not in the US system. And the reason being is that it's not something that the pharmaceutical industry can throw their IP over because it's your own cell. Therefore, it's now still a private treatment in all of those countries. But the addition of cell immunotherapy has been shown in many cases to extend survival and extend survival and good health because it has no side effects. That's where it fits into the landscape of cancer treatments.
So in Australia, is there any access to it?
No.
So you'd need to travel, despite it having, I imagine, and I'd love you to talk more about the clinical evidence, but despite it having substantial clinical evidence, we would need to travel for that therapy.
Correct. Just on that, it's a bit of a dilemma. For example, one of the cell immunotherapies called dendritic cell vaccines has been around for 20 years. And there are thousands of papers that show that it's safe and effective, yet the systems haven't adopted it yet. And organizations like ourselves, and there's a few that provide or produce dendritic cells, it'll take 40, 50 million to take it to the UK and put it through university hospitals, etc. And that kind of funding is not available to us.
You're right. So that's where the roadblock is.
Yeah, and just to give a little bit of science and very quickly. So most of cancers are triggered by a stress event. So, Guy, you have cancer cells in your body right at the moment, but your immune system gets rid of them.
Mm-hmm.
A major stress event, the system, your body can't find an enemy, can't find a physical enemy. So it shuts down the immune system as conserving energy.
Yep.
And what happens then is cancer cells have an opportunity to get together and have a party and become a health event. Once they become a health event, the cancer is very clever. It sends out signals to your immune system saying, fight somebody else, not us.
Yeah, right.
Cell immunotherapy is based on putting your immune system back in control, allowing it or giving it the information to be able to identify the cancer as an enemy and then go and fight it. So it's a very basic principle that just makes sense. And because it has no side effects, you either get a very good response or you don't. And if you get a very good response, you can extend survival 4 or 5 times, perhaps.
And so with that, if you've got 100 patients that come through with cancer, what's the percentage rate of success with that?
It's so the response rate is around about 50%. For stage 1 and 2 cancers, yes, you can cure if you get a good response. Stage 3 and 4, we're talking about extending survival and good health.
Yeah, right.
And so
is this an ongoing work? I mean, I have listened to a lot of the information from David Sinclair with longevity and cellular aging, and that is this sort of stuff come from the back of stuff that he's done, or is it completely different? Because a lot of people that listen to us would know of David Sinclair.
Yeah, no, it's very different. He doesn't get involved in chronic disease unless you identify aging as a chronic disease, and in fact it is, because it's an acceleration of cell health or deterioration of cell health. Mm-hmm. So no, what he does is very different than addressing cancer or autoimmune diseases. But by understanding the cell activity in chronic diseases, it allows us to then extend that to longevity.
Yeah, that's the pathway into that, isn't it? Because as you said,
that's the link. Yeah,
aging of the cells is part of that whole cellular breakdown, isn't it? And anything
correct.
you do to create healthy cells is going to give you a longer life.
Absolutely. And take away the conditions for chronic diseases, the acidity, the toxins, the oxidative stress. If you get rid of those, then you're on the path to controlling a disease, but then you need a big weapon to drive it backwards.
So Brendan, in terms of the types of, we are speaking specifically about cancer, the types of cancers that we hear about through our national programs here, bowel cancer screening, breast cancer, cervical or cervical cancer. Are these the types of cancers that you specialize in, or is this something that this cell therapy or cell immunotherapy would apply to any cancer?
It applies to any solid tumor. Blood cancers are generally dealt with in the system using a CAR T technology, which is cell manipulation, and it's a pharmaceutical product. We don't address that at the moment. We address any solid tumors, the ones you've just spoken about.
And in terms of the funding, just back to your point around the 40 or 50 million, that doesn't sound like a lot of money for something that would extend someone's life experience 4 or 5 times. What's getting in the way of finding a funder?
I'm in the process of that at the moment. So, I mean, that's one example to go to the UK. The world's big, and we're talking about that in every domain almost, because the medical systems seem to want to have control over their own domains. So if we got this approved, well, I mean, we've got it approved in a European country as an advanced therapy medical product, but that doesn't allow us to market it and promote or create awareness around it in places like the UK. But, getting back to your question, it does seem crazy. I mean, it's I mean, the WHO have forecast a 77% increase in cancer incidence over the next 10, 15 years. So, I mean, they're they're flagging that this is a growing problem. It's crazy that cell immunotherapy is not available.
Particularly when your success rate is 50% on people that come across that are patients that you can treat. It seems like diabolical, but that's the case anyway.
Yeah, I couldn't agree more.
This program is proudly brought to you by Ascend Performance Collagen Protein. Ascend Performance Collagen Protein uses the highest quality ingredients, is dairy-free and tastes great. Each serve contains 25 grams of protein and includes Tenderfort for joint and ligament support, as well as Gut Matrix to help support a healthy and diverse gut microbiome using a unique combination of pre, pro, and postbiotic ingredients. To find out more or purchase, go to ascendperformance.com.au.
And Brendan, so what do you believe is driving that increased rate of cancer?
If we go back to general health, it'll probably be a better way to explain that. Chronic disease is caused by a whole load of environmental and internal issues, generally inflammation. So if you can control inflammation, you can control most of the diseases that confront you. Your immune system is obviously critical. So a healthy immune system is the way to keep your body free of things that shouldn't be there. It's amazing that the immune system has been ignored by many professionals over the years because they tend to not focus on it as much as they would focus on the red blood side of your body. So your hemoglobin's low, they fix that, et cetera, they very, very few people take vitamin D3 and K2, which is a driver of your immune system. Yeah. And it would surprise you, I'm sure, to find that most of the population of Spain have vitamin D deficiency, which means that their immune system is not operating at an optimal level. I haven't looked at the stats for Australia. I would suspect that it's not that far different.
So that would be when you go back to inflammation and that being a cause for increasing cancer. I mean, lifestyle choices in what people do day to day would be critical in from what they eat to not exercising to being stressed out at work, I'm not getting enough sleep. All those things would contribute to what you're talking about.
Correct. And the increase in the reliance on pharmaceuticals to treat every single ailment we have is also a contributor. Pollution's a contributor. Stress is a huge contributor. And I think the recognition of all of those increasing in most environments around the world is probably a trigger for them forecasting this, because certainly places like the US, the life expectancy has reduced over the last 10 years, which you find extraordinary given that the amount of trillions that are plowed into medical research, it's not translating into good health. All of that is a huge disconnect. Yeah. And, as Carl said a minute ago, why haven't we got 50 million euros to go and prove what we don't need to prove, but they need proved, to have something like cell immunotherapy, which let me tell you is far less expensive than a couple of rounds of chemotherapy to the medical system. So it really is a dilemma.
Just on your point around deficiency locally in Australia, just for our 3 or 4 listeners to this podcast, we're
there you go. There's a good joke. Well done.
Thanks. Thank you very much. Yes, there's a 23% deficiency score according to the Australian Bureau of Statistics or Health Science or whatever it was that I've just read before this podcast. And that's quite interesting. And when you look at those people that are most likely to be deficient, some of those are quite surprising because we in Australia believe that we get vitamin D through the sun. Now, office workers in Melbourne would see there's 46 clear days in Melbourne every year. So those people who work in an office in Melbourne would need to scurry out into the street, into Exhibition Street, and try and get a little bit of sun on their body. But they're probably wearing a jacket because it's 7 degrees at the time. So they're unlikely to get it. Leachy, of course, who will wear his Speedos around the streets of the northern beaches.
Even winter time.
In winter, we know.
Yeah.
We know, we see
all year round.
There's police reports. So the lychee will do that. But what I have noticed, and I'm sure you'd be aware of this, Brendan, is that those people with darker skin and lychee, because of all of the solarium use in the 70s, has got very dark skin. They're also a bit of they're challenged in terms of getting their vitamin D.
Yeah, absolutely. And look, there's another factor here which you've missed, which is when you get to lychee's age, the skin is so leathery that it doesn't absorb vitamin D.
Please,
So
come on. Brendan, I got to tell you, I took your advice. I take K2 and D3. I take it through Athletic Greens. They've got a drop mixture that actually has the two of them in it. So I actually take that every morning now.
I bet neither of you have had your vitamin D level checked over the last 20 years.
No, and blood test going in next week to have that checked as well, thanks to you.
Excellent.
Mm.
Excellent. And look, there are some ratios that are, and I'm lucky enough to read bloods every day. So I get the experts' opinions on them as well. So you pick up things that are not generally measured. And I think, as I mentioned to you before, Guy, there are ratios that doctors don't measure that are critical to determine whether your blood or your system is in balance or not. The traditional markers are the ones that are generally just used. There's a bit more that you need to dig into.
And you can let us know now what some of those are?
Well, look, the ones that I prefer are LDH, ESR, CRP, and vitamin D. And if all of those are in balance, you're well on your way to you're getting a clear picture of what's going on. Yeah. I mean, obviously there are other markers that are important, but those ratios are very, very important.
Okay. And so is there just for those people who listen to this and want more information about those ratios specifically, is there something that you could point them to? I mean, we'd like to pick that up and put that on our site and make that accessible to our listeners afterwards.
Yeah, I'm very happy to send some reference materials. Absolutely.
Yeah, brilliant.
So just back, sorry, Guy, I know you're going to talk about yourself, but just for a second, for those people that encounter, a family tragedy, someone has discovered they've got cancer living in Brisbane, they will go into the system and go through a variety of traditional PBS listed treatments. Are you suggesting that there's a better way or at least an alternative for that?
No, I'm not suggesting that they go against their specialists and doctors' advice. All I'm saying is that there are other things that they can be doing. Simple things like a lot of specialists say that nutrition is not important and, exercise is, not important. It is. Keeping what I said earlier about your acidity levels down, your stress down, your toxins down, and your oxidated stress down is extraordinarily important in controlling the rate at which cancer can increase and thrive. That's about exercise, as you guys would, be very familiar with. A good nutrition. That's the start. The other bit of advice I would give is to question everything, because the system doesn't always manage every patient well. So I'll give you a good example. And not necessarily in Australia, but around the world, you find that there are protocols for chemotherapy. And a patient starts off in chemotherapy. The protocol is you will continue for these 6 cycles. So yes, they do check your platelet levels before the next round of chemotherapy to see that you're capable of having it. But what I observe that quite a lot of patients go through unnecessarily is they will be left on a chemotherapy regime that is obviously not working. And there's not enough diagnostics and not enough reviews taking place to say it's not working, it's destroying this patient's system. Therefore, we need to stop and then take a review and see what else we can use or we can try. That's one advice I would give. I mean, look, cell immunotherapies are available. Yes, you do need to travel, but there are ways of getting it to patients if they have the ability to travel. I'm not, here to promote cell immunotherapies. I'm more interested in just giving some general information about what I've learned over the many years of dealing with chronic diseases. And I know we'll get into longevity in a little while, but it is really interesting that, the Ayurveda and the Chinese medicine systems are now almost becoming obsolete in many developed countries. And I had an unfortunate discussion with a GP in a very developed country in Europe whose father was in India. And the father had been diagnosed with cancer. He was very interested in adapting cell immunotherapy, but there was a delay because of COVID and getting his father to the UK. He said, "Is there anything I can do in the interim to manage the situation so it doesn't get as worse or it doesn't get worse quickly?" And I said, "Look, get your father along to the Ayurveda doctor and see if he can start balancing him inside." Unfortunately, that GP said, Indian born, said, "No, I don't believe in that. I'm trained in traditional Western medicine." And that floored me, because those old approaches to medicine have a lot of value still in these times. And unfortunately, we've become a little bit too familiar with, single symptom, take a drug, another symptom, take a drug, and not pausing to say, I've got a knee problem, I've got constipation, I've got a headache constantly. Very few medics ask, what's causing this? The good ones do, but the system doesn't train most of them to say, what's causing this? And let's get back to the basics to try and take that particular causation out of the formula before we just prescribe 3 or 4 different drugs.
Just moving the conversation into longevity, because I think it's incredibly interesting to talk about new and emerging therapies for cancer and prevalent diseases and what that looks like. Most of the people that tune into this podcast, and Leachy's certainly very dedicated to this cause himself in many, many regards. And look, I am to some extent too, but living younger, longer, being healthier as long as we possibly can, outside of cancer and it being a limiting factor to longevity, is there a role for the work that you do in longevity?
If we break down aging, as I mentioned earlier, it is really a acceleration of the deterioration of your cell health. Some of that cannot be influenced at the moment, and some can. And the bits that can are about, how you conduct your daily life with nutrition and exercise and etc. There are also some pretty sophisticated heavy weapons that we can use to improve not only some disease, but also the cell health for longevity. I can go a little into the science of how cells deteriorate, but everybody can look up that. I mean, they can look up mitochondria and what that means and how that functions and how it deteriorates and how cells divide. And your brain cells, they divide or restore themselves once every 6 months, whereas your gut cells every day. That kind of science is very, very accessible. If we look at the interesting approaches now to longevity, it's based mainly on taking young energetic cells and their derivatives and using those to add them to an older person and allow them to get the benefits of a young cell. So highly ethical, being regulated and licensed, some of them already, some of them on the way. The key is things like umbilical cord blood, placentas, etc. So I'll go through a couple that are quite exciting and interesting. Mesenchymal stem cells, or should I say human-derived mesenchymal stem cells, can come from a variety of sources, mainly cord blood, which is where we derive them. These are not necessarily available for application at the moment. They're still going through a lot of work and a lot of clinical analysis and trials. To be absolutely frank, they still have some risks and associated problems if they're not properly prescribed. So if you prescribe them to the wrong person, my understanding is that there are some safety concerns. So put them aside, because more exciting and more safe, and completely safe as far as the initial tests and trials and work has been done, is human mesenchymal stem cell derived exosomes. Let me explain what exosomes are. They're not a cell. They're derived from cells. They're vesicles, so they're tiny entities that they themselves can be used as drug carriers, for example. So you can put a drug inside of the exosomes, and you can use them as carriers to bring them to correct a disease, for example, a brain tumor. The exosomes can be taken in through the nasal passage, still under a whole lot of trials, but appears to be a really sensible way and safe way of getting chemotherapy to a brain tumor. But put that aside, they display anti-inflammatory properties. So a huge effect on anti-inflammatory. Which can regulate
right down the avenue of longevity, right? So we're talking
absolutely. These guys carry information. Remember, they come from the youngest cells available, umbilical cord blood.
Yeah.
They carry cell-to-cell communications that we've lost in our bodies over time. So they're actually restoring information that we've long since lost.
And would that go straight into someone's body and it literally just spreads out and goes into different cells, or can you target these into a certain area of the body? How does that work?
For disease, you can target them. But
what about longevity? Is that just general?
Longevity, you don't need to.
Yeah, so you just inject it in and it would literally just spread into the older cells and rejuvenate them.
Correct, and you can apply them a couple of ways, and I'll get back to some of the things that they do in a minute, but just to answer your question. Recently, I was in our clinic in Lithuania. I had my second infusion of 1 trillion exosomes. So that was an infusion. So you can do that. You can do intramuscular, or you can do just subcutaneously.
Yeah.
So
and a trillion units going into you. What does that mean to the body? Like if you had a trillion of these exosomes put into your body, how much of that, the cells of your body, does that affect?
So you're talking about something that is very difficult to measure. I mean, very difficult. I mean, we measure it in the way that, or the effect that it has. So, I mean, I'm fortunate enough now to not have, that I'm aware of any diseases or in the ailments or anything that I'm aware of. So I measure it on how I feel, how my exercises are, how my immune system fights off everything, etc. But just going back to the benefit, and then we can come back to your question. These regenerate tissue, so you can imagine the benefit there. They, as I said, they restore the lost cell-to-cell communications. They aid recovery with anti-fibrotic benefits. They can have neurological benefits. So we're seeing that the application against some of the neurological degenerative diseases is actually proving to be worthwhile. Parkinson's, Alzheimer's. We've used them for MS, for psoriasis, for endometriosis, and seen real benefits, which are showing that this particular treatment, which is really wide in its application, including rheumatoid arthritis, and a whole load of more, which I think I've sent you some information about, whole load of other applications. So early days, licensing is done. We can apply them. We can prescribe them. The benefits of them are now, going into the longevity space for the very, very reason that they're improving the cell health. It's difficult in a short podcast to expand all the benefits of these things or even describe how they work. But suffice to say that the information and the ability of these exosomes to regenerate what the body has lost over the years, that it's been, the cells have been degenerating or losing their capability of doing what they do best, which is divide, build, and grow.
Yep.
Is extraordinary.
We had Carl and I had we had Nick Bell, who's a biohacker out of Melbourne. That his story was he flew to Mexico and was injected with 150 stem cell regenerative properties in his body for the benefit of actually doing what you're talking about. So I don't know, the difference between what he had done and what you're talking about, but he spent $700,000 of his own money heading up to Mexico and having that done at the start of this year. So so there are people out there pushing the boundaries and trying to live longer and live better and duck and weave disease.
Wow, that's extraordinary money. I mean, that's crazy stuff in terms of the kind of magnitudes that we're looking at. I mean, for example, one of the real superficial but still real applications of these is to to be an alternative to Botox. If you inject human exosomes into the face, two things happen. You get tissue regeneration, not muscle freezing. You get no toxins, and you get a longer term effect. So if we're looking at it as an alternative to something like Botox, we're not talking about that kind of money. We're talking about affordable for people who are interested in, looking aesthetically younger.
Yeah. So what you're saying is that it would not only improve the internals, but it would improve the externals as well. Yeah.
Yeah. Okay. So that's one example. There's two more I'd like to talk about today. The second one is placenta. Same thing. We have a blood bank. We get donations of cord blood and placenta. They're obviously screened for all sorts of history or disease, etc. So they're sterile. Protein fractions from human placenta can do things like increase the capacity for tissue to absorb oxygen. It can accelerate tissue regeneration, increase your capacity. So things like chronic fatigue syndrome, which is a huge problem worldwide, can be improved with this. It can improve sleep and mood. It again is anti-inflammatory because of where they come from and their youthfulness. Also potentially liver conditions like cirrhosis and hepatitis can be dealt with placenta. I can send you some fact sheets. You can share them around. They're very interesting because they describe the breadth of these applications.
Yeah, we really like that. I'm sure there's a lot of people, to your former point, when we're talking about exosomes, Botox is rife. The Northern Beaches, it's hard to see lines on anyone's forehead. You talked about
it's unfair to be picking on the Northern Beaches continuously.
Well, Eastern suburbs probably worse. And then you mentioned the neurological benefits, and I mean, Leachy's got the brain function of an 8-year-old, so hopefully that's something that can help
That's
him.
being youthful, isn't it?
But I do think that we run into these situations as well where we all have a predisposition to certain issues, be it liver disease, and we know fatty liver disease is an epidemic now. And that's the sort of thing that, for those that don't know, it does go from a fibrotic state into cirrhosis. And that's the end state before a non-functioning liver, and that's the end game. So if there is treatment for that, that's incredibly encouraging. I don't know that hepatologists in the Western world would look to this
No, it's a bit like the cell immunotherapy application in cancer. It's not on their pathways. They tend to not research it, and this is my opinion rather than the fact. But it's my experience that they tend to say, because it's not available to me, I'm not really interested, and that's unfortunate. But yeah, to your point, that's correct.
So we've talked a little about exosomes and placenta. You mentioned there was another area of focus.
The other one that's quite exciting is, and it's along the same lines. Again, it's about taking these young energetic cells out of cord blood, and it's cord blood plasma. Very much similar benefits, but very specific this time. Muscle tissue regeneration, brain function definitely, and an improvement in physical activity, pretty much the same as placenta, but from a different biological approach, and cell rejuvenation. So the accepted scientific quote is that it can drive the molecular clock back years. Now, some say 1 to 15 years. I don't know. But there's general acceptance that, and when I say that, I sound like there's enough scientists around saying that this is real to take it that the possibility of driving this molecular clock back is really possible. When you look at it from a perspective of the logic and the science, it's arresting and reversing the cell health, because the cell health is what we've been talking about all along. It's about the key driver to aging.
I look at the aging process, and the things that I can control, and Carl and other people out there, is your sleep, your social connection, your exercise, your nutrition, getting good medical checkups and the like. In the future, like the stuff that you're talking about, if you looked at it at over 100% of aging and being younger longer and running the clock out with quality, what are we talking here? Like these types of protocols that you're talking about. I mean, are we talking in 50 years' time that these are things that we'll all be doing, that people that are around, because it just proved to give you so much better quality of life and longer?
The exosomes now we can produce. This is the human mesenchymal stem cell exosome. Sorry, it's a mouthful, but I keep repeating it because up to date, most exosomes have been derived from plant, so they haven't been human. So they don't have the same potency, don't have the same information, etc., etc. They're available for us to use now, so we can manufacture them, we can prescribe them. That doesn't mean we can have them delivered to Northern Beaches and
if you go to Istanbul,
have a doctor.
You go to Istanbul, you can jump on the program.
No. I mean, it's just it's a couple of steps away, regulatory. So it's not 50 years.
Yeah.
I mean, we're working now to try and introduce these in different territories and regions, and the step between getting them licensed in Europe and licensed in places like UAE is not that big. So we've got medics in Dubai at the moment looking at making these regulatory acceptable, and it's paperwork rather than long-term clinical trials. They're done. I will also add that they're an ATMP, an advanced therapy medical product. My opinion again is that the legal system is not caught up with the science. Therefore, the regulatory system is way behind, and some of the medical regulatory bodies put these in a corner. They call them ATMPs, and they say, well, look, we're not really sure what to do with them. This is my opinion again. And they don't give clear guidelines on how to deal with them. That's general. So it's going to take a little bit of funding and not too long before we can get these accepted, get them applied, and get them available. And look, our focus has been for diseases, chronic diseases in particular, not necessarily longevity. your interest is more in longevity in some respects. It's come out of this work into chronic diseases and cell health. So yeah, it's not going to be 50 years in my view. It's going to be a lot quicker than that, and they are available now for anybody who wants to.
We're getting on in life, so
yeah. Well, I'm sorry, but I'll try and hurry up.
Could you do that, Carl? I'm worried for Carl.
I think the main thing out of all of this is that there's a treatment for your old leather handbag face.
True. You too.
Just to circle back before we conclude, this has been incredibly interesting, Brendan. But you did mention you've had your second infusion yourself, and you've monitored that through the way you feel, your exercise. Now, obviously, you wouldn't be doing that personally if you didn't have 100% certainty in the safety protocols and what that's likely to do. Have you got any success stories, any sort of big success stories we can sort of finish on where you've seen someone come in with X and they've left with Y?
There is one in particular that stands out because it's a colleague, rather than talk about somebody who's a little bit disconnected. This is a colleague who is very, very happy to talk about her experience. So she is a female, mid-40s, has had endometriosis for almost 20 years, faced with a major operation. Her monthly regime was a couple of days on the bathroom floor in excruciating pain, horrible discharges, really, really uncomfortable. We connected her with our specialist, and the specialist prescribed exosomes to try on a trial basis, and she had about 3 months worth of subcutaneous injections bi-weekly to start off with, and then weekly. Suffice to say that the outcome of that was that her pain was non-existent. Her flow was clear, was constant rather than clotted, and she's now not rushed into any major operations. So heaven knows what the long term has in store for her, but it's had an incredible benefit in her life. Now, she hasn't gone through the normal scanning process again to see how the fibrosis, etc., has reduced, but that's a good example. There are many more of sort of patients that have used this, and the effect that it's had on different conditions. For me, as I said, I'm lucky enough not to need it for addressing a particular condition, but in terms of general health, I think it's given me some benefits. And I'm now starting up some subcutaneous injections because these things can travel, so I don't have to go to the clinic. But instead of 1 trillion, it'll be 100 billion in a subcutaneous injection. And I'm happy to continue because the benefits with sleep, etc., have been quite demonstrative.
And what? How often do you do the injections based on that amount of volume that you're putting in?
As often as I can get my wife to say, "Yeah, we'll do it today." Weekly normally.
Wow, fascinating. No, I started the podcast today saying that you're on the bleeding edge of science, but this is a real standout conversation for us. We've had cardiologists on, hypnotherapists, a variety of exercise therapists or exercise physiologists, I should say, all incredible talent. But this is a mind-blowing conversation that is very much not just speaks to eradication or the limiting of chronic disease, but it sits fairly and squarely in what we're trying to do with longevity. So thanks so much for joining us on the lounge today.
You're very welcome. And look, I'll send through some data sheets for you to use as reference points, and very happy to do a follow-up at any stage, get into a little bit more of the science if you wish, or to talk about it in a practical sense with some other examples.
On you, Brendan. Thanks for your time, mate.
Thanks, Carl. Thanks, Guy.